Welcome to the Youth Evolution News. This is Ventrina and today we are in conversation with Dr. Sarath Gopalan, Pediatric Gastroenterologist, Senior Consultant from Rainbow Child Hospital, New Delhi.
Hello.
Today he is present at Dr. Prince PARAKH's Newborn Child Care Clinic situated at Jhankarmore, SILIGURI. So doctor, what are the basic food habits that a child must follow to have a healthy lifestyle and a well stomach?
Let's start from the first year of life. It is best to prolong breastfeeding as long as possible and focus on breastfeeding at least for the first 6 months of life. This is in fact a government guideline and a World Health Organization guideline that you should have exclusive breastfeeding in the first 6 months of life. Because breast milk is the best milk for the baby and it solves a lot of problems later on. After 6 months of age, one should focus on starting to feed semi-solid food in addition to breast milk as early as possible, because the breast milk alone won't be enough to meet the basic requirements of the baby. So it should be supplemented by other semi-solid natural foods. For example, something like oats. You can supplement it with something like thin soups. You can supplement it with something like mashed banana, mashed potato, apple puree, things like that, which give a variety of the type of foods supplemented, and the baby learns to rapidly adjust to home food which everybody consumes later on in life. So the more semi-solid foods are introduced early, the easier and smoother is the transition of the baby from taking mainly a liquid diet to a diet which is semi-solid or solid. So that is important. Then coming to school age and the older age, including teenage, the type of foods eaten. When we were young children, we used to mostly eat home food, and even our birthday parties in school were held in each other's houses. Today, most birthday parties are held outside in a public place, and most of the type of foods consumed are foods which are rich in maida, which is basically a form of refined wheat flour, and also rich in preservatives and more milk based. So most of these foods taken over a period of time lead to a problem of constipation, because children tend to focus more on these foods, take less of water, take less of natural foods, eat less fruits and vegetables, and this is a pattern which has been followed over the years. The children today by and large are not consuming adequate water. This is a pattern we have seen over the years. They take less water and they don't focus much on a variety of foods. That certain types of foods which are the fashion at that point in time, they would go out and have those foods. So they fill themselves up more with energy drinks quite often, and that also contributes to filling up the stomach, and the child doesn't feel hungry.
Doctor, what are the common gastro problems that are faced by children in today's day?
Well, the commonest cause we encounter in our regular day-to-day work is a child coming to you, the parent saying the child is having a lot of pain in the tummy off and on. So stomach pain or abdominal pain is perhaps the commonest complaint. Now, the causes could be many, but the commonest cause of abdominal pain in children, even in a child who's passing motion every day, is an incomplete evacuation, incomplete emptying of the bowel. These are children who don't pass their motion properly every day. So even though they may be going every day, a small amount comes out, but a good part remains back. And this is a problem going on for months or years. When it reaches a particular stage, then the child starts to feel uncomfortable. The child is loaded with stool and gas builds up. And the gas is not able to come out, and that leads to more discomfort and bloating. So this is a very common problem we encounter. Other problems which we are increasingly recognizing is a condition called gluten intolerance. Now, gluten is a protein found in wheat, oats, and barley in India. Oats abroad is quite safe and gluten free, but oats in India, the way it is grown and the way it is prepared, there's a lot of contamination, cross contamination with wheat. So even oats, by and large in India, is contaminated with wheat and it contains gluten. So these foods, any foods which are made from these three cereals, wheat, oats and barley, or any food which is not made from these but there's a contamination with these things, those things cause a damage to the intestine, leading to a destruction of the absorptive capacity of the intestine. So the intestine is not able to absorb. If the intestine is not able to absorb food, the child will fail to gain weight and later on will not gain in height also. There will be a growth failure. Along with that, the child may have symptoms like abdominal pain and cramps off and on, sometimes loose stools, sometimes even constipation. And there may be, because nothing gets absorbed, the hemoglobin may be low and the child appears very pale and becomes tired very easily. All these are features of this condition, which medically is called celiac disease. But the term is essentially an intolerance to the protein gluten found in these three cereals, wheat, oats and barley. Another common problem is infectious hepatitis. Hepatitis means, the word hepa is a Latin word for liver, and itis means inflammation. So hepatitis means inflammation or of the liver. So this is, in a large number of cases, is caused by contaminated food, dirty food or water, and that leads to infection, what we call as jaundice, which happens mainly in school children. Now we have vaccination available for one of the viruses which causes this kind of food and waterborne thing called hepatitis A. We have a vaccine available which can be given to the children, and it's regularly given in most clinics now. Hepatitis B is another form of jaundice or inflammation of the liver which occurs, but this spreads through body fluids. It doesn't come through infected food or water, but it comes through body fluids like a blood transfusion or sharing toothbrushes or a cut on the body and infected fluid falling into that, things like that. So these are 2 or 3 of the very common problems we encounter. Then there may be other conditions which we encounter in children which involve inflammation of the intestines, something called inflammatory bowel disease. Now this requires specific treatment with specific drugs and is long term. So these are the common problems. Then diarrheal diseases, very well known. Diarrheal diseases largely are infective. In very young babies, it may be usually viral diarrhea, in which case antibiotics are usually not indicated or needed. The diarrhea subsides spontaneously on its own, but it's important the child doesn't get dehydrated. So when there's excessive fluid loss, vomiting and diarrhea, you should make sure the child receives adequate liquids. That is most important.
What do we mean by fatty liver and why does it happen?
Very, very common problem we encounter in children, and this is more seen even in very young children, but is more commonly seen in older children and teenagers. This is largely, most of the fatty liver is related to overweight and obesity. A person who is significantly overweight is more likely to develop a fatty liver. On top of it, if there are genetic factors which are contributing to fat deposition, that will add on to that and make that individual even more prone or likely, more at risk to develop fatty liver. So in addition to environmental factors in the community, and this is mainly related to overweight, and the reasons for overweight are mainly 2. The type of food taken, more of junk food, more of fatty food, and less physical activity. Today what is happening? People are scared to go out because, one, there's more crime, so people are scared to send their children out to play. Second, the roads, even while traveling, because of the high amount of traffic, people are not comfortable sending their children alone, even walking on the road, that they may cross and they may not be comfortable. Some parents are scared. Third thing is, in this kind of season, dengue fever is very rampant. So they are scared to send their children out, saying the mosquitoes will bite and the child will get dengue. So there are a number of reasons. Fourth is, there's so much pressure, academic pressure in school, even from a young age, that the children hardly find time to go out and play. So and mostly their interest now, by default, has turned to the iPad, and they are playing their games on the iPad, and there's hardly any physical activity. So eating more of rich fatty food and less of physical activity will make the child bloat, and that's the commonest cause of a fatty liver. And there's been a huge amount of work done on this for treating fatty liver in children. In adults, some drugs have been showing to have some utility, but not long term, but at least for some time they help. In children, it is very sure that none of these drugs actually help. So the only thing which works in children is proper diet counseling and adequate and appropriate physical activity. So that is why diet and physical activity, which is something perfectly doable, you don't need a doctor for that, is something which can be really put in, the effort can be put in by the family at home towards their children, and we'll have a generation of children who don't develop such fatty liver as the previous generation did.
What are the foods that should be omitted by children in today's day?
I would say no food should be completely omitted by children, because we quite often have an all or none approach, which sometimes is not practical in real life. The whole idea is to have a balance in the diet. The diet should be as balanced as possible. If a child wants to have a pizza one day, no problem. Let the child have pizza. But make sure the child has had adequate vegetables. Make sure the child has had cereal. Make sure the child has had roti or chapati also in that day. So somewhere there should be, a pizza can be taken once a week. But it's important the child take natural home food, which is healthy food. More focus on green vegetables, more focus on fruits, more focus on water intake. These kind of things are important as well. So the aim is to maintain a right balance. That way you will gain the child's confidence. It's very easy to say, aaj se tum ye nahi khaoge, you won't have anything from tomorrow, we won't give you this. But the child will on the slide cheat the parents and try to find, because the child has developed a taste for that food. The child is seeing in the media, the TV saying ye bahut acha hota, is seeing the ad. He or she is going to get motivated and try to have that behind the parents' back. So it's important that the child also realizes what is healthy. For example, you take the cracker movement. The schools have been so active. Many children genuinely believe today that bursting crackers on Diwali is actually polluting the environment. They themselves have given up crackers today. So such a movement should come also for food. Children should understand themselves that eating certain kinds of food on a regular basis may be harmful for the body, and then the self-discipline will come in. Rather, it always works better than enforced discipline by somebody else. We can show the way, but ultimately the children should imbibe it.
If an 8-month-old baby is passing watery stool without blood, what is the reason behind it and how it can be managed?
Well, you see, it again depends on, has the child had been passing watery stools off and on so many times before the 8 months. A lot depends on that. In which case, there's a pattern. Why is the child been having so many episodes of passing watery stools? That is something which needs investigation. If it's the very first time in a child who's been taking regular food and now has started eating semi-solids also, is taking milk and other foods also, then the situation arises that could it be a possible infection which the child has picked up. Maybe the child put the hand somewhere here and there and put the hand in the mouth. The infection may have got in that way. So if it's an infection, The infection could be either viral or bacterial. The child should be investigated appropriately, a stool test, if necessary, 1 or 2 blood tests which are important to find out if the infection has become more extensive or not, and be treated with the right medicine appropriately. It's very common in children, diarrheal disorders.
Thank you so much, doctor, for sharing your valuable words and information with us. We are glad to have you on the Youth Evolution News today.
Thank you.